My name is Tara, and out of the three patients, I found patient A the most interesting because my son was just tested for Marfan syndrome, and I had a friend whose daughter was diagnosed with Marfan syndrome. She's in high school, and she had to stop doing sports because of the potential risk, cardiac risk. So patient A complained of syncope. He was tall and thin. My oldest is 6'8", and he's 19. His 15-year-old brother is 6'2". So a lot of times people with Marfan syndrome have, they're tall, but they also have a large wingspan, and their fingers can be longer than normal. There's a few different tests that you can take, the doctors will do to see if you have it, in addition to the cardiac tests. So the way my friend's daughter found out was her sister, actually in childbirth, went into cardiac arrest, and so finding out that it was a genetic component to it, all of the people in her family got tested, and then they found out that one out of three of their daughters ended up having it. But for patient A, the auscultation findings were a systolic murmur. The echocardiogram found an aortic aneurysm. The MRI findings was an aortic aneurysm, and the pedigree findings was that it's dominant. So Marfan syndrome is something that is genetic, and it's passed down from parent to child. Patient B was presented with breathlessness and erratic heartbeat. That patient was a dwarf. The auscultation findings were split sounds. The echocardiogram findings were a congenital atrial septal defect. The pedigree findings were that the inheritance pattern was that it was recessive. And then the electrocardiogram findings was the Ellis-Van Creveld, the EVC syndrome. And then patient C presented with dyspnea and fatigue, and the auscultation findings were a diastolic murmur. The echocardiogram findings were mitral valve leaflets, that they were thickened and not moving properly. And then the pedigree findings, even though there were other people in the family that did have it, it's not inheritable, so it wasn't dominant or recessive. And then the electrocardiogram findings, the ECG, were mitral stenosis, and that was from rheumatic fever as a child. So I thought that was interesting. It wasn't genetic, but other people in the family had rheumatic fever, and so therefore they also presented with the mitral stenosis.